fakery, the amount of scams, stem cell injections galore, water through the knee, fake treatments like ultrasound and electricity. The fact that these treatments are so prevalent and the public gets so easily duped into spending money on these ineffective treatments tells me that we as physicians have been holding on to way too much medicine. We need to start educating the public.
Today on the podcast, we have Dr. Georgiy Brusovanik, who is a Duke-trained and board-certified orthopedic surgeon. He specializes in minimally invasive spine surgery, operating from the heart of Miami, Florida. He was born in Moscow, Russia, and completed his medical education in the US. He has a clear passion for spine surgery. He's actively on TikTok making videos, educating the public on more about spinal problems. He has operated on professional athletes across the world, on singers. You've also done other physicians as well, which is quite interesting. And I'm happy to bring him on today. Dr. Brusovanik, pleasure to have you.
Try to create, keep going with my education. And since I didn't really have any resources, I didn't really have any connections, like most immigrants, I made a decision that, it's either a doctor or a lawyer. It's a pretty well-paved pathway. So I said, okay, let's go down the longest path possible. We'll take out school loans. We'll live off school loans. I'll pay them back whenever I can. Let's try to push it. So I went down a specialty coincidentally that involves the longest amount of training of all specialties. I had this real amazing mentor here in Miami, whose name is Gaetano Scuderi. He's a spine surgeon as well. We actually met through Gracie Jiu-Jitsu. I've been doing Gracie Jiu-Jitsu for 20-some years. And he and I met the first 2 weeks of me doing Jiu-Jitsu, and he showed me what it's like to be a spine surgeon. We did a lot of research together, tons of publications, and I just really became enamored with that field. So back in high school, I said I'm going to go into medicine. Somewhere in college, I said spine surgery, and ever since then, I was on a track to become a spine surgeon.
Interesting, but still, the chances of getting that residency, and it's a long path, because before you get into med school, you need to do an undergraduate degree.
Sure. I'll tell you a funny story.
Go ahead.
So when you apply to residency, you have to send in your request through what's called the match system, through a computer program. And through this program, you select which residencies are reasonable to you, and you put them in the rank from favorite to least favorite. And residencies make their own list of students, who is their favorite, and so on. So before the list was finalized, I was invited to do an interview in the University of Hawaii, and I had no connections to Hawaii whatsoever. I was excited to go to Thomas Jefferson or Beaumont in Michigan, top-notch programs with a good reputation. But my mentor says, you got to go to Hawaii. It's an amazing program. You'll have the best life there, and you will learn more than anything. So I went to Hawaii for my interview, and I was supposed to go to Carnival to Brazil with my friend, and I called him up and I said, bro, I have to go interview this for a job. And he says, I'll come with you. So the two of us go to Hawaii, and we spent a week and a half before my interview surfing, and my particular interest, Gracie Jiu-Jitsu, a very well-known Gracie practitioner whose name is Helson Gracie. He actually has an academy in Hawaii. So I reached out to Helson and I trained with him. And the first day that we trained, there was a man there whose name was Jim Scoggin. And Jim and he was a purple belt, I was a blue belt. So I had a lot of fear that he was going to hurt me. And I didn't know him, I just showed up at this academy. So we start to roll together. And I'm being a little aggressive, very defensive, still honoring the respect, the jiu-jitsu camaraderie, but I'm just telling you, I was a little rough. So we finished training, and we shake hands, and it's totally cool. And he goes to me, I heard you are interviewing for the orthopedic program tomorrow. And I said, yeah, actually I am. And he goes, well, I'm going to be one of your attendings. I'm going to be one of your professors. So I'm thinking to myself, I'm screwed. I was just, too aggressive in training. I go to the interviews, and the residents get to interview the incoming candidates. And as I go room to room to room, interviewing with all these attendings, including Skagen, all we talk about is Gracie Jiu-Jitsu. It got to a point where we were this close to going on the floor to show each other some permutations of arm bars. Some of the residents were into it, some other attendings were into it. Nobody cared about what research I did. No one asked me about all my volunteer work. It was all about Gracie Jiu-Jitsu. So literally, Gracie Jiu-Jitsu is how I was introduced to spine surgery, and that's how I got into residency.
That's interesting, because it's more about building connections on a personal level, on the people you kind of know.
You got it, exactly. So I was very happy 6 years. Hawaii residency, contrary to its name, is not a piece of cake. It's not a resort.
Yeah.
You have 2 residents per year, and the volume is insane. There's a lot of, I operated day and night. And case-wise, when I finished, I was in the 99th percentile for surgical volume. So we did something like over 5,000 cases over that residency period, which was just insane. So which was good. When I finished residency, I really felt like I could operate. I felt like I was safe. And then I went to Duke. I learned spine surgery, traveled, and opened my private practice here in Miami.
So, I had a thought over there with other listeners listening for some advice in terms of if a medic's trying to get a residency, they could just find out who are going to interview them for the residency, and then try and do research of what the interests are and kind of build a rapport on that. No one's ever spoken about that. So that was a good piece of advice that you gave, because that can make or break your career if you're trying to get into the dream or desired residency spot.
I lecture students all the time, and I tell them the same thing. If you want to get into a program, find out who is on the board, read all the research that they wrote, get to know them. And then when you show up, find some commonality. Once you do, it's more than just some guy off the street with good records. And once you're at that level, everyone's got good records.
Sure.
Everyone's got top-notch grades. The only way to differentiate yourself is by having a good character and making a connection.
That's some good advice there. So what was your favorite part of medical school? Because we all know it's quite intense. It's 4 years.
I loved medical school. I loved everything about it, because truthfully, just like at Hogwarts, you are being taught things that no one else is being taught. Rules of society go out the window. You can touch people where it's inappropriate, ask inappropriate questions. You can cut off heads from cadavers. You can see inside a person. You're not supposed to do any of these things in normal civilized society. And it's for the good of a person. So not only you get to deliver care, you get to help people, you get to be a good person. I can't say enough good about being a physician. I love my job. And it really gives you a perspective on life that is very hard to glean just through life experience. I'm not trying to say that if you're looking to touch people inappropriately, you should go to medical school. All I'm saying is that you're doing things in medicine that aren't normal for civilian life, and you're doing them for the right reasons too. So I feel that all of med school was amazing. I had this one professor whose name is Dr. Flipsy. And Dr. Flipsy made us record ourselves when we talked to each other. 2 students would be paired up. One would pretend to be a patient, one would be the doctor. And she would make us record ourselves as we interviewed each other. And I can't tell you how horrified I was the first time I saw myself talking to a mock patient. That type of lesson where you get to really see yourself from the side, it's so helpful. So I learned a lot about human interaction through medical school. I learned a lot about how to interact with people, how to communicate with people, how to listen. And then you see the underside of the human mechanism. You see how things work, how things fall apart. And on top of that, you get to meet all these people and learn from every interaction. So I love what I do.
I'm glad you did. That's like, I've had colleagues who are MDs and they've told me your best days are in medical school.
I don't know
if that's true.
I had a great time in residency too. And then I had an amazing time in fellowship. It was really one of the best years of my life. I'm not sure if I would hate on any of my years in training. I had a pretty good time, but I got lucky. I had some amazing mentors. At Duke, I had this guy, Chris Brown, who, I've worked with a lot of spine surgeons. I've modeled my method of operating probably mostly on what he does, which is ultimate respect for soft tissues, ultimate care of the patient when it comes to surgery. I've learned to talk to patients from some other physicians. I got really lucky.
I'm glad you appreciate it, because people say, if you want to go into medicine, depending on the field you're in, if it's a calling, it's a blessing, because then every day you're enjoying every day. It's not work. You're getting paid to do the thing that you love doing. And I think I can see that within you, and that resonates to patients who come and see you, the advice that you give. Definitely. And I'm glad people are getting to see that, especially in TikTok, because you put some good information there. And we'll talk more about some of the treatments that you have been specializing in your minimal invasive procedures. The next question is, you've kind of answered it, but I was actually going to talk about, in terms of your residency, did you ever rank any other specialities you want to go into, or did you just put everything into?
I was thinking about doing pediatric cardiothoracic surgery and plastic surgery. So one of my old mentors is Dr. Michael Salzauer. He is very well known on social media as Dr. Miami.
Yes.
He was first plastic surgeon on Snapchat. He's an absolute marketing genius. He's an excellent surgeon, very good person. And he was finishing his training when I just started. So we would walk around the hospital together. He would be doing plastic surgery, and I was just a medical student learning. So we're walking through Jackson, which is like a big, crazy hospital, going patient to patient. And all of a sudden, Michael stops, and he stops me, and he's like, "Gosha, what are you doing here?" And I go, "What do you mean, what am I doing here? I've been following you for the past week or so, learning about plastic surgery." He goes, "You need to go to orthopedics." Just like this, out of the blue, you gotta go to orthopedics. There's this room at the big hospital here in town at Jackson called the Pit. The Pit is where all the orthopedic residents hang out. This is where you go to get a cast change, to get a cast placed, to reduce a fracture. He goes, "You need to go to the Pit, introduce yourself, and tell them you want to be an orthopedic surgeon." Just like that. So, third year medical student. I go in there, I meet this old man whose name was Hiram, who'd been there for like 50 years, who was a surgical, ortho tech. And Hiram introduced me to the rest of the guys, and the rest is history. I became an orthopedic surgeon.
I suppose it was kind of written. People were kind of pushing you in there, and you got yourself in the right situation, position.
Yeah.
Your mind was always in there. And
Ram, you've been to professional conferences. When
absolutely.
You go to a professional conference, you go to the room, everyone in that room looks exactly like you. They all wear the same clothes, they have the same interests. Like, we are not unique at all. When I go to the orthopedic meetings, there's about 10,000 orthopedic surgeons there, and they're already pretty similar. When you go into the spine room, you really do not feel special. So, I mean, our specialties breed us to look a certain way. Now I'm 6'2", 250 pounds, with a history of doing martial arts, and I've been doing sports my whole life. I played water polo for years before I got into Gracie Jiu-Jitsu. So I'm a little bit of a jock. It was natural for them to say, "Go be an orthopedic surgeon."
Because you need to have that kind of manpower, right, to
You
I've seen some
think so,
procedures.
but actually some of the best orthopedic spine surgeons I've seen have been girls, have been women. I really don't think that you need much strength, and I hope girls that are listening to this who are thinking of becoming an orthopedic surgeon, please consider the fact that you do not need to be a big, beefy guy to do spine. You just need to care, and you need to be very careful, move slowly. The instrumentation is very user-friendly. You don't need to have a lot of muscles to do that. Not that girls don't have muscles, but you know what I'm saying.
Yeah, I know what you're saying. And one interesting thing is like the ego in medicine and surgery. We always have, I've got colleagues, I know people within my field who all say that they're the top surgeon, and they look at the success rate and they kind of protect that, and for me, I'd rather just take the risk. I don't really care about my success rate. Like if the person needs the procedure, even though the chances are slim, I'd rather just do something if it's going to better the position.
Yeah.
But this aspect of like being number one, the top surgeon, I think is false, because there's no league. There's no league where you're competing. To be honest with you, anyone who goes into a surgical field or any specialty, they're all the best. You've gone through so much rigorous training.
It's the best doctor.
Yeah.
I'll tell you something funny. A lot of patients who come to see me fly in to see me from New York, all over the country, but New York specifically.
Yeah.
And in New York, there's this funny circumstance in that, not sure whether vis-a-vis good marketing, good branding, or maybe some factual difference from its neighbors, but HSS, Hospital for Special Surgery, has sort of established its dominancy in this very competitive market in New York City. And a lot of New Yorkers will think that HSS is the best institution, and if you want spine, you need to go to the chief of spine surgery. Now, you and I as physicians know that the chief of surgery is usually far from the youngest, far from up to date, usually, on the most advanced technique. Usually it's a guy who has published a lot because his students publish with his name. So he appears to be most published, most senior, and sort of the best quantity. But in the end, if you have a problem, you're never seeing that guy again. And now you went to a guy who you think is the best in the city, and now your pain is back. What do you do? Who do you go to? So I specialize in revisions, and a lot of these patients find me online, they contact me, and the list of things that can make a spine surgery bad is a short list. So my job has just as many clear, common things as any other job. It sounds complicated, revision spine surgery, but it's all the same stuff. What's common is common. It's just that I encountered this issue of, I had the best. My surgeon is the best. I encounter this issue every day. And in my mind, I always want to ask the patient, do you think that your mom is also the best? Are you like the kind of person who thinks that your dad is the best? I mean, what does that even mean, the best? That's a legitimate question. What makes your doctor the best? And then you may say, well, results. Yeah, but not really, because of what you said earlier, which is, if you are a specialist and you see complex pathology, sick patients, complex patients, you will have more complications. So if you just go by complications and you compare that brave surgeon to someone who just cherry picks easy cases, that second type of doc may have less complications. That doctor may have much happier results if he stays away from sort of the complex. So I think the takeaways from this are, one, the best surgeon is somebody who is not going to abandon you in a field of battle. The best surgeon is the guy who can diagnose the problem, answer your questions, operate, and carry you out, whether you come out complication-free or with a complication, he can or she can see you through until you are good. That's the best surgeon who can do that for you as a patient. And if your surgeon is the best because he told you he's the best, then I would definitely get a second opinion.
No, I agree with you. I always actually tell friends and family about that because I'm quite strong on that. Like, I've been around people in hospitals and I've seen the type of the personalities in them. If someone has to tell you that they're the best in something, then they're really not the best, because the best is someone you actually see. It's a third person who actually experienced something from them that then can pass that experience on to someone. That I've been to so-and-so and I saw this person, he did something different. He did something that I wanted done, and I believe they're the best. It has to be from a third party, sort of, if you like, than someone telling you directly. Interesting question, because spine surgeons come from a specialty of neuroscience as well as orthopedics. Tell me more about that. Do they overlap?
Neurosurgeons generally don't do fellowships, which means that the 5 years of training was dedicated to spine somewhat, whoever was the dedicated spine guy in that department, and then they do brains the rest of the time, which is a whole different world. Orthopedic surgeons become spine surgeons only if they do a fellowship, which means dedicated time with a high-level spine surgeon that has been approved by the American College to educate fellows. So there is definitely a difference between orthopedic surgeons and orthopedic spine surgeons and neurosurgeons, but it is not any more characteristic as a difference between one neurosurgeon and another. Because at Duke, for example, ortho and neuro work together. So I actually worked with like 14 different spine surgeons who were either ortho or neuro, who were doing the same things differently, and I was able to pick and choose things that I like. Whereas other programs may be only ortho, only neuro. There is even a push to create a spine-only residency that focuses on spine exclusively, because human spine is so different really than brains or the rest of the extremities. I would say whether a doctor is an ortho or neuro should be denigrated to a lower level of importance, just like whether the doctor is an MD like myself or a DO. In the end, what makes a difference is one, does the doctor do the most modern, well-tested procedure for your problem? Number two, does that surgeon have good reviews? Meaning that when patients have bad outcomes, does he abandon those patients, which will usually result in a bad review, or does he see them through until they are recovered and back to good? And then you want to look at whether the guy or a gal has a lot of lawsuits and judgments against them, because you may not get everything you need from just looking at the reviews. I'd say those are the most important things to find the right doc. Ortho, neuro, it doesn't matter. Look them in the eyes and ask them, how many procedures like this have you done? How many complications have you had? And what did you do about those complications? And within the response, you will see whether this is a kind of a person you want to entrust with your well-being.
Got you. Right. That was quite interesting, because I also was educated on that, something that I wanted to know more about personally as well. And your work, I mean, what's your typical day like? Like, do you have a set schedule, amount of hours you do a week, or is it hit and miss every
I do clinic on Mondays, Thursdays, and Fridays. And then I do surgeries usually on Tuesdays and or Wednesdays. And my typical day is pretty easy going. I wake up in the morning, I hang out with my kids. I roll into work around maybe 9:30. I see patients, no lunch, no breaks, until I'm done about 3 o'clock, 3:30. And then I go home to play with my kids. If there's good wind, I'll go kiteboard. And I like to go to Jiu-Jitsu, same school that I started originally 20-some years ago, except that now I get to go with my two girls and I get to marvel at them getting their stripes and their belts and them learning how to do Jiu-Jitsu. I'm married, happily married, and I spend time with my wife. We travel quite a bit. And then I have all those humanitarian projects, my Dream Space Clinic, so I have to spend some time on that. I have a medical school that I started online called the Prometheus School of Medicine, where a large number of very talented college kids who are pre-med will interview physicians in a very guided way to provide very useful medical information to the public. I think it's time, just like with Prometheus, to take medicine from the codes of the doctors, from the inner pocket, and give it up to the public. So we focus on that, and now we are in a stage where we're going to start fundraising so that I can provide these real talented kids with some money to actually go to medical school, to an accredited medical school, so they can become MDs and DOs and continue dispersing information. So those are sort of my love projects. I focus on them when I'm not focused on operating and seeing my family.
Interesting. So you don't work on weekends. You've kind of created this work-life balance where you try and maximize the week and have the time for your family.
Thank you for saying that. I strive for work-life balance, but it's definitely a process.
Yeah. Tell me more about the medical school project you did online.
Sure.
Medical school project.
Sure, absolutely. We are called the Prometheus School of Medicine. I read this book called Freakonomics, long time ago, written by two economists. I'm sorry, I'm blanking on the name, but it's a very popular book. And I believe it was that book that talked about the fact that real estate agents really make money at least they used to make money, by holding the information to themselves, the MLS, and you'd have to go through the real estate agent to access that information. And it really affected me in that in medicine, it's the same story. If you don't pay me, you don't get to find out what I know, and you need to find out what I know to get better. So I thought that was really kind of an injustice. Now, it's not an injustice to physicians that are trying to make a living, but at the same time, the amount of fakery, the amount of scams, stem cell injections galore, water through the knee, fake treatments like ultrasound and electricity. The fact that these treatments are so prevalent and the public gets so easily duped into spending money on these ineffective treatments tells me that we as physicians have been holding on to way too much medicine. We need to start educating the public. If 50 years ago, the presence of antibiotics was news and it's no longer news, today there are other things that should be available as information to the public. I'll give you a perfect example. What is the treatment that worldwide saves the most lives?
I would say it's probably penicillin.
So, Ram, I applaud your answer, but I would take it even one step further. There is a treatment that saves more lives than any other. That treatment is IV fluids.
Oh, I get it, yeah.
So in countries where access to clean drinking water is a problem, and I think we've learned a lot of this from the research done by the Gates Foundation, you'll see that infant mortality is through the roof. And it has nothing to do with necessarily common conditions that afflict kids in Miami, but it has to do a lot with dehydration, diarrhea, dehydration, diphtheria, E. coli in the water, poor sanitation, only part of the problem, because remember, not all kids die, some survive, and none of the kids have to die, because if you just provide them water supplementation while they recover from the disease, they'll live. So the public isn't aware of this. I get the flu, I go to a local IV spot right next to my house. I spend 45 minutes getting 2 liters of fluid, and then I go home normal, healthy. So this is the kind of information that I believe the public needs to be aware of. And of course, there's information like this in every specialty, which is why Prometheus School of Medicine is really focused on separating this knowledge into fields and then digesting it and presenting it in bite-sized pieces, just like TikTok, in a way that the public can understand, not using medicalese, but using real, legitimate, normal, common language. I feel like it's really rewarding to provide this information for free to the general public. There's so many others. There's so many others in every specialty. For example, in Florida, last week, there was a big debacle between the crowd that opposes abortions and the crowd that wants to keep it as pro-choice. And that resulted in Florida in the sex ed textbook being banned because of the argument of whether we can talk about the other pronouns. So Prometheus School of Medicine picked up the baton. We immediately bought floridasexed.com, and within a few weeks, you will see a brand new website where sex ed will be provided in a comprehensive way without excluding one group or excluding the other group. And we're going to offer this worldwide because access to this information, condoms, hygiene, the fact that a girl should be able to stop a sexual encounter anytime she's not at all required to do anything she's not comfortable doing. And this is non-denominational. God or lack of God has nothing to do with this discussion. This is basic human rights. So we're going to try to educate the general public with this using the same Prometheus resources. And by the way, one day I would love an opportunity to talk about how many sexes there are. Because I think that the debate has really stalled due to lack of clarity in nomenclature and complete lack of understanding of human biology. I can't wait to get an opportunity to say my piece on how many sexes there are out there.
But absolutely. I mean, that's another discussion, which can go on for quite some time. I can imagine we could probably have another podcast in the future on some of those matters.
That would be amazing.
Yeah. And now I want to come back to you. You do a lot of procedures, and I also looked on your website too, and because I've also been watching a lot of videos on TikTok too. You do minimal invasive decompression surgery. You also do fusion. You mentioned, in the video, 3 reasons why you should avoid a fusion. And then you do disc replacement, spinal cord stimulator implants as well. So those are some of the things that you specialize in. But I'm more interested to know more about if you have a patient who comes in. Are there some other conservative treatments that you provide before you look into the surgical route?
Absolutely. Every patient who comes into my office, 98%, will undergo epidural steroid injections. And I believe that in the list of conservative treatments, these injections allow the most patients to avoid surgery. And
do you have like a management or treatment plan where you, obviously it varies from case to case, but if you had someone who came in, would you try every conservative measure and then evaluate that and then perhaps look, okay, this is not improving. We might have to try a surgical intervention at this stage?
Ram, in Russia today, you could go to the hospital and get prescribed a treatment inside a broken CAT scan machine where you get to lay down, they make some sounds, and then some people get better. And it's okay to do placebo treatment in some scenarios. In my world, people come to me for a second, third, fourth, 10th opinion. They are looking for things that are most effective. So I don't see ibuprofen for 6 weeks as a viable alternative. I do not see physical therapy as a way to get rid of deformity or a disc herniation. So when patients come to me, whether it's conservative treatment or surgery, they want to see clear objective results. In my world, what works are three things: time, steroids, and surgery. That's it. I don't care if your inversion table cured you. I don't care if your CBD cream is a miracle and that's the only thing that gets you through the day. Great. You're not going to get that prescription from me because there is no evidence. Personal experience, even expert opinion, to me is just an opinion. Show me a study where a group was randomized to receive CBD cream versus placebo. If there's a difference, I'll believe it. Until that day, my job is to stick to evidence-based medicine. So if a person comes in with radiculopathy, sciatica, neck pain, torticollis, lumbago, they want to be better right away. And when they fly in to see me on their own airplanes, they expect to fly back without pain. And the only way that you can achieve that, the only way that you can almost guarantee it, is with a properly targeted transforaminal epidural steroid injection. That's the modern way to do this injection. That's the only way that you could leave my office and be pain-free. Now look, in some patients, these injections don't last. And if they don't last, we can fix the problem. But by the point we come to an understanding that the injection did not last, I've obtained something that's most precious. I've obtained the diagnosis. I know beyond a shadow of doubt, after injecting you and having your pain go away, even for a short period of time, I know with certainty that's where your pain is coming from. When we go to surgery, there's no surprises. You know exactly what's going to happen after surgery because we've confirmed. We've gotten a sneak peek into the future.
I can definitely reason with you there because I have the most common condition in podiatry is plantar fasciitis. And I've kind of gone to where I use corticosteroid injections myself, so I can kind of relate to you on that, where patients come in, you give them a bit of exercises, orthotics, change your footwear. But the main thing is this problem was probably there 1 year before. You're getting symptoms after 1 year. So it's more of a biomechanical anomaly. Obviously, the plantar fascia is stretched. It's connected to gastrocnemius, so you want to stretch those tight calf muscles. But the thing is the pain, if it's very severe, then perhaps corticosteroid injections can help in that treatment plan where they can continue doing exercises. But obviously, the corticosteroid injections, you can only give so much in a year. You know, there's only so much you can give, and you probably get 6 months to a year pain-free out of that. So I can see that, but the problem's still there. So you're kind of surgically trying to correct it, because if the steroids don't work, then the problem is within doing a surgery, an operation to kind of fix the root cause of it. So there's just something that came there, it's looking about the root cause more than just treating the symptom.
Absolutely.
And what about your minimal invasive procedures? Did you kind of, is this something a lot of your colleagues are doing, or do other orthopedic surgeons who specialize within spine surgery, do they push more for minimal invasive procedures?
Well, I think you'll see a lot of younger surgeons coming out of training doing things the minimally invasive way. There's a bit of a learning curve in operating through a tube, in using very long tools, specialized light, specialized magnification. My old boss at Duke, he was an old guy. He got retrained and he got really good at it, but I could see that the learning curve is steep. No, I'm far from unique in doing things this newer way. But I'm a firm believer that there is a difference when you do a big, wide open operation and destroy the patient's muscles. There's a big difference between that and sneaking in the most sparing way possible, correcting the problem, and then sneaking out.
Got you. And there's two more last things. One you're passionate about when we were talking on the phone was stem cell therapy and incorporating it within spine surgery, and it can provide better options.
Ram, I'm up to date on stem cells, and I'm going to disappoint you. If I take a bunch of little kids from kindergarten and I have them hang out with you in clinic, are they going to become great podiatrists like you?
Probably not.
It's the same thing with stem cells. You take immature cellular lines, whether you get them from the amniotic cord, which then goes to the freezer, or from the fat, from the blood. If you even believe that some of these cells survive the journey, what makes you think that injecting them into the knee is going to have these cells develop in line with cartilage or with ligament, whatever is the defective part that's causing pain? There's no evidence to say that stem cells will become what they are surrounded with. There's no evidence like that. The current state of science is to figure out how to train stem cells. How do you make stem cells develop in one or another direction? Some of this technology is very effective, but it's few things that are effective, whereas there's just a mountain of poorly indicated, poorly executed stem cell injections for which everyone's a candidate with a credit card, which is the big bugaboo of any medical innovation, is that once it becomes popular, it sort of enters the magic realm. And it's very unfortunate. Stem cells are an option, but it's not enough to just take them from the freezer and put them into the knee. Most patients who come to see me who spend lots and lots of money on stem cells will honestly admit that it was a waste.
I can see that.
There's a company out of Jupiter, Florida, that had its partnership with Stanford, while Brown University was doing the same research and corroborated the results completely, which is just eerie. Stanford had the intellectual property. Brown was doing this without that information. Same results. We get the platelet-rich plasma, and then we suck out through another machine one protein out of that whole fluid. See, PRP's got all the elements: build, destroy, bring blood vessels, take away blood vessels, pro-inflammatory, anti-inflammatory. But one protein called alpha-2 macroglobulin, or A2M in short, was developed by a very close friend of mine. That protein will slow down your own cartilage debris pickup crew. So there are these sort of stem cell-like crews called metalloproteinases that drive around your knee and your hip, and they clean up cartilage that's been denuded or been injured. They can become overreactive. And if you slow them down, you see an incredible improvement in patients' extremity pain and joint pain. Just one example, but it's not enough to just take some freeze stem cells and push them into the joint. It's wishful thinking.
And I can see, I remember coming across it back in 2009, and I kind of stepped away from the kind of development from stem cell therapy. In the beginning, it was a big hype. I had a friend who was a physician back in the UK who set up a company. I think he just let it go, but it was just something that I thought I could talk to more about with you, because you had an interest in it. I thought maybe there was some sort of like new innovation coming in now in 2022, but I suppose it hasn't really taken course yet because it has limitations, as I can see. And
it's coming, but it's going to come with different sort of name. It won't be just bring some stem cells from the freezer. It will be, how do we get your own cells to behave in a way that is controlled, expected, and reliable. That's the future of stem cells.
And talking about the future, what about robotic surgery? I've seen some videos on TikTok getting quite popular, and some surgeons talking about it.
Surgery. It's great. You can take away radiation using X-rays. You can expect ultimate precision in placing instrumentation. It makes posterior spinal surgery easy and safe.
And is something you're using currently, or you're looking to get into?
Yep, I love it. I'm all about navigation, innovation, and visualization, anything to improve my accuracy.
And I also heard you can even work remotely. That's the next kind of advancement, where you can be anyone.
Sure. Absolutely. And this is all coming. I mean, already I'm working remotely by doing teleconferences. So many patients contact us through social media, through finding me online. And before flying in, I love to talk to them to make sure that indeed it's a problem that's fixable. Usually it is, but I'd hate for someone to take a long trip for something that can better with an injection or something simple they can get done locally. So yeah, teleconferences are amazing.
And can you do some assessments that way? Do you find, even if you don't have any sort of hands-on to the patient, that you can?
I've learned to really listen to patients, and there are studies that look at what patients say and show you how much those very same statements correlate with pathology. For example, if someone says when they get in and out of the car that they need to grab their leg by the pants and lift it in or out of the car, that patient, 95% of the time, will have a hip problem. And there are great studies to prove that. So I've learned that if I really listen to patients, and everyone describes their symptoms differently, but if I really listen to patients, you can pinpoint the problem.
Absolutely. It's just classical signs and symptoms which you see for certain conditions. Just in any specialty, everyone has them. So I can see where if you just listen to the patient, just getting that information from them is part of the assessment. You can kind of pinpoint what is the main cause or condition.
Exactly.
And lastly, what are some of the sort of, not advice, but information you can provide people if they want to look after the back? You know, I'm in a profession, I'm just sort of bending down. I've got colleagues who've had back problems who are older than me, and they always tell me, Ram, just look after your back. Because sometimes I'm bending down and they're like, well, that's not good what you're doing. And I think it's a concern a lot of people have.
Ram, I actually have a course that should be completed in the next month that's aimed at physicians, nurse practitioners, physical therapists, chiropractors, acupuncturists, and really anyone involved in the care of back and neck. And we'll go through the anatomy, what are the realistic painful parts, which are gimmicks and which are real approaches, what's the true current level of evidence. And hopefully, with the help of this course, many providers will be enriched and will protect the public from all the magic talk, from all the scams that is really plaguing a plague on current back and neck care.
Well, it's been a pleasure to have you on this podcast. Where can people find more information if you want to get in touch with you?
Really easy, spinedoctormiami.com. I'm on social media, although I have an impossible name to remember, Brusovanik. So,
it's not too bad. It's not too bad. You can
a lot find me as the Russian spine doctor. But I'm happy to help anyone. And by the way, when it comes to insurance or lack thereof, I have a unique practice in that we take care of patients first, we worry about money after. So, I do take all insurance, but primarily I take patients. So if someone doesn't have insurance, doesn't have means, they can just call me.
Yeah, and finally, you're on TikTok as the spine doctor.
Yeah, it's been a real treat learning this new method of teaching through short clips, but I believe, I drank the Kool-Aid. I believe that that's the new method of educating the public. I don't want to hear the introduction. I don't want to hear the backstory. Answer my question. You have a minute. That mode of teaching, I think, is going to be the future. So I had to sort of convert. And Prometheus, the medical school, really, the way that we deliver message is bite-size and applicable information, applicable format. So love TikTok. Excited to see how far we can get with sticking purely to education and meaningful information.
Well, pleasure having you. And perhaps in the future, we might have you again.
It would be amazing, Ram. I would love an opportunity to hang out with you some more on air and keep chatting. You're a pleasure to talk to.
Thank you.